Alright, so today I'm going to show you guys how to, first of all, how to draw and fill a syringe with hormones, whatever it may be that you're taking, and also how to inject your front delt. Okay, so the first thing you're going to do is you're going to take off the needle tip that comes with the syringe, set it aside, and then you're going to use a larger needle. I typically use 20 gauge just because I don't like using the 18s because they tend to tear the rubber stoppers up a little bit too much. So you put that on, you twist it on like that. Once you have it on, go ahead and get an alcohol swab, open it up, and you swab down the rubber stopper on each one, right? And so I'm doing 1 cc of Sustanon, 1 cc of test prop, and 1 cc of NPP. Okay, I start with the Sustanon. I typically flip the vial over like this. It tends to make it come out easier. And once you have it pinned in, then you start pulling out. And you pull out till you hit the 1 milliliter or 1 cc mark. And once you're there, pull that out, set it aside, move on to the test probe. And you can see it comes out pretty quick. Okay. Getting rid of all the bubbles, and you line it right back up. Okay, and we're gonna go to the NPP. Also flip it upside down, and you draw. Okay, and then that's done, and you pull that down the whole way. Put this back on, and you unscrew this, and you go back to the original needle that it came with. And I like to use, I typically like to use the, where'd it go? The 25 gauge. Just because it tends to, for me personally, it causes the least amount of scar tissue and goes in easier. I've tried 27 gauges, but those are too thin and it takes an hour and a half to inject. But anyway, once you have it in there, you just kind of roll it around, mix the hormones together. They're all oil-based, so you can put it all in the same syringe. Now, if one of the hormones is water-based, you can't mix it. So, but in this case, you can. So back and forth, back and forth, back and forth. Okay, and then you pull back, and then you slowly come up like this. Okay. And then I kind of like lube it up a little bit. I let some come down along the syringe just to kind of help it glide better once it's going in. And you get another alcohol swab. And then you wipe down your front delt in a big circle. Make sure it's nice and clean. And once you've got that done, then comes the fun part. So you want to make sure that you have this, your front delt as relaxed as possible. You want it to feel kind of, you know, flubbery almost. And you obviously want to make sure you don't hit a vein. So once you have it injected, you aspirate. I am not the kind of person that just jabs the needle in. I like to slowly kind of work it in just to make sure that I'm not hitting any nerves or that I'm in the right spot. It's a little bit of a longer process doing it the way I do it, but that's how I prefer it, and that's what works best for me. And then once I have it in, then I kind of do like a slow tap until it's in the whole way. And trust me, the slow tap does not hurt as much as it sounds like it would. For me personally, doing a fast jab tends to hurt more, and it tends to cause more post-injection pain for me. Everybody's different, but that's the way I prefer to do it. But anyway, so once it's in the whole way, then you proceed to then you proceed to inject it. And you want to do it pretty slow. Typically a rule of thumb for me is 30 seconds per cc. So if I'm pinning 3 cc's, I try to make sure it takes me about a minute and a half to inject. That way the hormone is distributed properly and, you know, slowly throughout the muscle tissue instead of building up a pocket of hormone in one particular area. And specifically for your front delt, I mean, it's a relatively small muscle group. So, you know, you want to make sure that you pin it slow enough so that it can distribute itself properly. So I got 2 cc's in, I'm on the last one. And test prop is one of the more painful shots to inject, and that's mostly just because it's so fast acting. So typically hormones that have longer esters attached to them, like enanthate or cypionate or decanoate, they tend to hurt less. Whereas esters like propionate, acetate, they tend to hurt more. So once I've got it all injected, which I do, I typically count to about 15, just to make sure that, you know, the hormone's in there the whole way and that it's not going to come shooting out or oozing out. And then when I pull it out, I'm going to go like this and lightly, well, at first start lightly massaging the area that you injected. And then you become a little bit more and more aggressive with it as, you know, the time goes on, because you want to make sure that it's fully distributed amongst your front delt. Okay. like literally like no blood. I usually don't really even get any blood when I pin. But yeah, so that's how you pin your front delts. Very simple, very easy, and very efficient.